Alright, this is our lidocaine scenario. We've got Pat Smith, a 49-year-old female, who's been hospitalized with weakness and dyspnea. We've noted multiple PVCs. She's got a triple lumen, which we'll be demonstrating with a double lumen. Tunneled to the subclavian central line. One port is being used for your IV mainline of normal saline that is running at 100 mils an hour, so I'll start that in a second. And our physician's orders are to administer 0.7 to 1.4 milligrams per kilogram IV bolus. We're going to start with the 0.7 just to make sure we're not giving too much, knowing we can always give a little bit extra if we need to. And then following that will be a lidocaine drip at 2 milligrams per minute. So to start with, I'm going to set up our normal saline as if it's already been running. Make sure we're not clamped anywhere. Alright, so my primary line starts 100 mils. And we've got a 500 ml bag, so we'll throw it at maybe 475. Looks like there's a little bit out of there. Alright, so our 100 mils an hour is going. Our bolus we've figured out with his weight, and the dose is going to come out to 4.5 mils. It does not need to be diluted. So alright, there we go. Alright, so first thing I'm going to do is wash my hands over here. I'm going to put my gloves on. As I'm doing this, I'll introduce myself to my patient. Most likely they've already seen me before. But if they haven't, just in case, my name's Sammy. I'll be your nurse for the afternoon. And because your heart rate's being a little funny right now, we're going to be giving you some lidocaine to try and get it back to normal. My guess is they'll already understand that something's feeling weird. That's why they're at the hospital. So while I'm doing this, I'll make sure to check the 5 rates. I'm going to double check the patient with 2 forms of ID, name and date of birth, as I'm going through the MAR. On top of that, we'll look at allergies, compatibility, rate, time, dose, all this stuff to make sure we got everything right, which we do. 15 seconds. I'm going to draw up my 4.5.
Okay.
Alright. That's my 4.5. Carefully recap that. Alright, so I've got my bolus ready. So in this case, we know that normal saline and the lidocaine are compatible. So we can administer the bolus through the Y site to help the normal saline kind of wash it through and act as a flush. We'll scrub that for 15 seconds. And this is going to be administered over a minute. So slowly administer this. Because it's compatible, we don't need to clamp anything off or worry about separate lines. So we'll just say this has been a minute here. We're all finished with that. So all of this stuff will get disposed of in sharps. So now we are ready to set up our lidocaine drip. So got this. Again, because we're compatible, we can just put it in the separate line there. This would have a cap on it, so it would maintain sterility. We've got this. Get it scrubbed. We've got everything primed through the line. It's just clamped at the bottom so we're not dripping all over. We'll get that up here. Let's make sure we unclamp it. And when we did our our math, we figured out it's going to be at 30 milliliters per hour. So we'll do line B. We'll just do it concurrent since we know that they are compatible. We can use it as a flush again. We'll set it at 30 mils per hour. It's a 250 milliliter bag, so maybe set it at 245 so we don't run the line dry. So we got 30 mils an hour for 245 milliliters. And now we've got the lidocaine running. So at this point we double check patient, make sure they're still feeling okay, make sure the IV site's feeling okay. We don't want anything bad to happen, don't want the heart to stop or anything, so you probably double check a heart rate just to see how it's going, and at that point everything should be set up.